Some good numbers here. So I am going to get started so I don't leave anyone hanging. My name is Carrie Scott. I work at Spruce Health. I am going to be serving as the moderator for today's event so that we can guide the discussion and panel in a meaningful way and make the best use of everybody's time. Incredibly glad that you've joined us today to talk about how layering HIPAA-compliant medical communication technologies can eliminate admin for your practice. I think we all know that tasks like fielding calls and conducting insurance and setting up clients in an EMR takes time away from patients for hours every week. And that's why we're going to hear firsthand from a practice that employed Spruce in this case, along with virtual assistants to offload all that admin, the answering of phones, the scheduling, the verifying of insurance, while at the same time scaling their practice and maximizing time with their patients. So what we're going to do is get right down to business. Today, we are going to cover who everyone on this call is, what they do. We're going to review the published case study that highlights the challenges that were faced, along with the solutions that were employed and the outcomes that were enjoyed. We're going to go deep with Impact Physical Therapy and hear from them how they were able to transform their business. And then we're going to turn it over to our audience to get your questions answered. But before we go there, just some very quick housekeeping items. Please use the Q&A function at the bottom of your screen to ask questions of any of the panelists today. We're going to save time at the end, but be sure to drop all your questions there and we'll get to them. Also, this event is going to be recorded and shared with everyone that registered. So keep your eyes peeled for a follow-up email. I will also send you the link to the slides, the case study, and the other resources that will be mentioned at the end. So you will not miss out on anything. So with that, let's start with some intros. I'm going to let everybody here introduce themselves, and I'm going to start with our guest speakers, Mark Plonner and Christopher Lang. Hi, guys. Please introduce yourselves.
Yes, hi. How you doing? My name is Mark. This is Chris, and we're an outpatient physical therapy practice specializing in orthopedics here in the New Jersey area in East Windsor. We started the clinic about less than a year ago, and so that's what we're all about.
Okay, good stuff. Thank you. We are so excited that you're here with us today. Appreciate you taking this time away. Let's hop on over to Mike, founder of BBC Global Services, Virtual Assistants. Mike, fill us in on what you guys are doing over there.
Thank you, Carrie. My name is Mike. I'm with BBC Global Services, and we provide HIPAA-compliant virtual assistants, as well as other supplemental staffing assistance to emerging and medium-sized businesses alike. We started in 2017. We have 2 offices in the Philippines, 1 office in India, and our corporate office is in the great state of New Jersey. Some think it's a great state, more specifically in Scotch Plains, New Jersey. I actually personally started outsourcing in 2002 out of the necessity to cost effectively compete with one of our largest competitors offering 24/7 technical support at the time. It was an amazing success, and felt that helping others experience my success would be a good business, and so far it has. But back to you, Carrie.
Love that. Thank you. So you know what? I'm a fan of the Garden State. My grandma's from there. Thank you for giving props to New Jersey. That's right. That's
representing, right.
Yes. We're going to round out intros with my own Jessica Gulish, head of sales at Spruce. Tell us a little bit about Spruce for those on the call today who don't know us.
Yeah, welcome everyone. Thanks for joining. I'm seeing some of the names come through. I'm seeing some names I know as customers. So thanks for joining, and some new names out there too. So some people may not know what Spruce is. Just briefly, we're a healthcare communications app. We do everything from your business phone system in office to using your mobile phone with a separate number, texting, telemedicine, secure messaging, and faxing. And we collaborate it all into one unified platform, kind of seeing that little that little image there. And then it's also mobile friendly and web friendly. So really easy to use communication anywhere you are. And I just quick shout out. I'm really excited about this call. So thanks everyone for joining, because I've been working at Spruce for over 5 years, and I've seen the last 2 years a huge uptick in people in clinics that are getting started or existing clinics using virtual assistants or having staff that may not be located in their office. So Carrie and I talked, and I really wanted to learn more about, practices like Mark and Chris's and Mike from BBC Global, kind of how that works and why. Like, why is there this uptick, and how is it working? Is it working? So that was kind of the antithesis of why I wanted to see this come together. So excited. And I'll also be manning the Q&A. So please just put your questions in there, and we'll get them answered at some point. Or we'll also be able to, you can reply to your email, the email we send you if you still have questions. So, and thanks, Carrie, for hosting.
Love that. Thank you so much. And thanks for helping with the Q&A. Takes a village. With that, let's get into the good stuff. So this case study was published earlier this year, and we are going to share this with you in the follow-up email. It speaks at a high level to the challenges that Mark and Chris faced when they first launched their practice about a year ago, and then the steps that they took to overcome that. So getting right into it, they were first and foremost, and I think that the real reason why so many folks joined us today, they were faced with, okay, we've got to overcome our front end and our back end admin, because like any new business, these guys had to start lean before they could justify hiring more staff. And that meant pretty much tackling everything themselves. But that DIY approach meant that they were truly on the hook for everything. They were answering phones, they were, contacting insurance and setting up clients. And that really took a lot of time away from what they wanted to be doing, which was spending time with their patients. So this model clearly wasn't going to be sustainable. And that gives you a little bit of background. Always love a good flywheel here. And if you take a look at what we've got, you can see visually that, Mark and Chris were underwater here. They were doing everything I just mentioned, all the upfront, all the busy work. They were managing the intake paperwork, consulting with third parties, ensuring that they were up to speed before a patient visit. And then, of course, they were meeting with patients, they were creating custom rehab plans, and then they were documenting that visit in painstaking detail. So, when I first took a look at this and got to know Mark and Chris, I thought, how do these guys find time to eat and sleep? But I think what we really want to know from Mark and Chris today is, when did you realize that you were not going to be able to keep doing everything yourselves?
Yeah, so well, I guess when we first conceived of like starting a clinic, it was probably back in 2018, and we were going to do it the traditional route where you rent space and you kind of move forward. Due to some delays on our side, we weren't really ready to ramp up and launch up until about spring of 2019, and at that point things had drastically changed. And which created a lot of issues because of COVID and so forth. And so what we realized was that we couldn't just leave our jobs. We had to have a part-time job, if you will, and then also deal with or start the upstart of the clinic. And so what we needed to do, we couldn't have a structured. We need to be working and then also fielding, during our free time or spare time, different things like credentialing or new patient intakes and all the other stuff that you do. So we started looking for an application or some type of phone service that offered our ability to fax, email, also internally create internal messages and so forth, that we could do it all from our phones. And the idea of getting an expensive phone system, that wasn't part of what we were able to do. We couldn't do that. So I started searching around, and we basically started looking at different options. We do a lot of research on the blogs, and we looked at I kept on going to different therapists, blog sites and so forth, and eventually came with a list of different vendors and suppliers and so forth, and started to saw that various ones had different options, and then we decided to sort of link up with with Spruce at that point, because they offered an internal messaging app, the fax, and email, and so forth, and you're able to get and make phone calls from your central number. So it really worked for us.
I love that. Yeah, in fact, I love when you told me that, there were times where you might be in your car and you'd have to pull over, but you knew that you could do it all from your phone.
Yes.
Which is incredible to think that, you truly are mobile, you're remote, you can tackle all those tasks wherever you are.
Right. Right. Go ahead. And then we realized that scalability was limited, in terms of we would have to basically block out certain hours to do the administrative tasks. And we realized that we needed to treat all day, and we couldn't just do everything, all on our own. So we realized there needed to be some type of change of some sort.
Yeah. Well, that makes sense. And that actually segues nicely into this slide, which just at a glance illustrates, okay, so you took that first big step and you realized you needed a communication platform to help you streamline your comms. And of course, to communicate securely with your patients and your doctors, among other things. So how did you know that this software existed? I mean, it sounded like you were looking for fax and messaging and phone and email. And given that this was your first business for yourselves, how did you know that you could find all that in one? And how did you find Spruce?
Well, the first thing we needed to make sure was that it was HIPAA compliant. Originally, when we first started doing credentialing and so forth, we did get a number with an 877. It was, I believe it was Grasshopper. But after doing a lot of research, Grasshopper was not an option. And so again, kind of like what we do with all vendors and suppliers, we're looking for things that are going to be kind of like introducing technology to make things more efficient. At that time, I was working at the VNA, and what I realized was that they actually do a lot of interesting things because they're kind of all virtual, like your management is completely virtual. So they use this internal communication app to sort of streamline the patient's intake all the way to discharge. And there's different communication notes, doctor communicate, if you talk to the doctor, you write an MD communication note, and with visit verification. So everything is just timelined in there. And and so that was also something that we were really interested in having incorporated into it. So we were looking at various different components of it, obviously tethering in all our different communications centrally that could be organized right underneath the patient, which we thought was pretty fantastic. And it just gives everyone clarity on what's going on with the patient.
Mm-hmm. Yeah, I love that. I'm curious, how did you decide to roll this out before the virtual assistants, or before adding maybe a part-time assistant to your staff? How did you figure out what came first?
Well, I mean, so in the very beginning, Mark kind of mentioned that we were both transitioning out of other jobs. So we're both working other jobs simultaneously. And so when we started our own practice, we, wasn't very busy early on. So it wasn't like a huge need to go out and have to find somebody and employ somebody in a location that didn't even really exist, because we actually started by subletting in a fitness center not far from where we are now. And so because we weren't terribly busy, it didn't make sense for us to look for an employee. So, we were doing all the administrative tasks, obviously, along with the physical therapy stuff that we do. But then as things started to ramp up, it became pretty evident fairly quickly that we were going to need help because of the fact that it was very time consuming. I mean,
yeah.
The length of time it takes for you, and if initial phone call comes in, if you're lucky enough to be available to field that phone call, you might be on the phone with a patient for 5 to 10 minutes, gathering their information, insurance information, demographics, and what have you. And then you have to follow that up with a phone call to an insurance company, which could be anywhere from 10 minutes to 45 minutes. It was just extremely taxing time-wise. And so I guess the short answer is very quickly did we realize that we needed some help.
Yeah. Yeah. Well, that makes sense. So it sounds like almost straight away that helped you really overcome a lot of that pesky admin that you were having to deal with and that was consuming so much of your time. Just out of the gate, did Spruce help you manage your patient care better, or was the immediate benefit more the reduction in the busy work?
I mean, for me personally, like, so Mark was working for a home care agency. I actually was working in a hospital system. So for me personally, like, I was working in a busy clinic. I mean, I couldn't pick up the phone and start having a conversation around my other colleagues at the time in regards to fielding patients for the job that I was planning on eventually going to. So Spruce for me was nice because I could communicate through the app within Spruce without having to actually talk to the patient out loud. Additionally, you know, I could ask them to send me pictures of their photo ID and insurance card. So that kind of eliminated like a very lengthy conversation. I had pre-saved messages saved within Spruce that I could just very quickly tap and send the messages that we were redundantly sending. So for me personally, that's why Spruce was very, very helpful early on.
That's great. Yeah, those saved messages can be a true lifesaver. Okay, so it sounds like Spruce made a lot of that upfront stuff and the process is so much more efficient. But from what you've shared, you were still handling a fair amount of the admin yourselves. And I'm guessing that's what made you realize, you know what, we need another layer here. We need Spruce, but we also need a virtual assistant. How did you get there? And let's get into that good stuff of how you decided, you know what, I think this is going to help us even more.
So I guess we kind of went that once we opened up doors here, what we had to do, again, as I mentioned before, we had to almost block time out to do the administrative stuff. So the follow-up with the visit, you know, the benefit verification and all that other stuff. And so one of the things that we really want to do is we wanted to make sure that most of our clinic, which is 1,600 square feet, is dedicated to treatment space, you know, or patient care. And so, you know, so we wanted to limit any type of, you know, sort of administrative stuff to actually zero in our clinic. We figured that could be done either, you know, remotely. And this way it saves costs. So that's kind of, you know, where we were at with that. So we didn't want to have anything inside like our clinic. And so we figured that would be the most efficient and most cost-effective way.
Yeah, and additionally, like when Mark, so after we were subletting for about 8 months or so, and we finally got our own space, and we started to get, you know, more patients, whether it be walk-in patients or new patients via phone calls. We were still by ourselves. And so there were times where we may have to like literally stop a treatment to field a phone call, or if somebody walked in or something, we had to kind of, you know, speak to them for a few moments. It just got to be too much to handle. In addition to still making those phone calls to insurance companies, which unfortunately could be very time consuming. So it was just, you know, obviously our goal overall is to provide very high quality care hands-on. However, the administrative burdens were going to make that tough to do without assistance.
And then on top of it was the climate. We're still in COVID, or we were in COVID, and there was a lot of things going on. Like, for instance, it was almost entirely difficult to find anyone to work. So we had almost like staffing issues as well. We did do some interviewing. People were like no-showing. We heard that like McDonald's was like charging, you know, or paying people just to interview.
Wow.
You know, for jobs. So, I mean, it wasn't, you know, we very quickly realized that we may have to go, you know, to, you know, like some type of like staffing or, you know, and that's when we started looking around and, you know, and we weren't just looking domestically, but we were also looking for, you know, people that deal with international support. So, and then we did a lot of research. So first initially on our, you know, like with everything, we did a tremendous amount of research, trying to scour and find the right fit for us.
Yeah, that's fascinating. I didn't even think about that aspect and to your point, you're right. Cause I know I live here in San Francisco and restaurants have a very hard time hiring. And so as a result, they're short staffed and it makes everybody's lives harder. I didn't even think that, of course, that would be an issue for you. And that combined with the fact that you were in a small space. And I think we joked earlier that, you know, what were you going to do? Put a a part-time person in the laundry room, right? So you didn't really have the space for another body. And then of course, having this, a staffing or a virtual assistant is almost a no-brainer in your case, because you knew you could count on that and that it would be consistent. Did you evaluate other virtual assistant solutions? How did you find out about BBC in particular?
Yeah, I mean, we interviewed a whole bunch, and we were just like, again, with anything, we just look what's like the perfect fit for us. We didn't, you know, we were going through a lot of growing pains, and learning a tremendous learning curve, and we needed something or a service that really understood, you know, I guess the evolution of, you know, what, you know, our practice. And how, you know, it would evolve. And we were just kind of like looking for a service that, you know, kind of would handle, you know, and also not leave us in the lurches. So like, if say for instance, you know, the assistant is not available, that, you know, or has to take a day off or something like that, that we have coverage. So that was kind of the big thing. We didn't want to not have coverage, not have support. And then also the training modules, let's say for instance, an assistant leaves, that there's, you know, that there's, you know, there's a, you know, that there's backup and so forth, that, you know, there's not a tremendous learning curve to bring another assistant back on board. You know, and obviously that's a huge thing for us, because we deal with a lot of headaches, you know, like, I mean, if anyone's a practice owner out there, you deal with a lot of headaches, and having like the staffing headaches of someone not showing up, or, you know, that's not, you know, that doesn't happen. You don't have those phone conversations or those conversations with staff. So that was another thing that we were really super interested in. Anything else to add?
No, I think you covered.
Yeah, well, and I understand that when you first introduced your VA to your business, that you created and documented certain protocols so that she would know what to do in every scenario. And I think an added bonus there too is that then you had a playbook that you could use if she were sick or out of office or on vacation. Someone else could pick up that playbook and easily step in. What was that like, and what was the onboarding like? How long did that take? And, you know, how did that feel?
Sure. So our assistant, her name is Welmerly, actually. So she, this was new for her in terms of what we needed her to do. And since we were pretty new to it ourselves, we had a very clear understanding of how to basically come up with a complete playbook of what the processes were. So for every very specific insurance, it was slight nuances, if you will.
Mhm.
So we created this manual, and we're training her kind of simultaneously as we were creating this manual for her to reference if she needed to. It probably took about a couple of weeks before we and also she felt comfortable enough that she can start answering phone calls. But there was probably a lot of Q&A back and forth. If there was a scenario that she wasn't familiar with that kind of had arisen. So we were communicating very, very consistently through Spruce with her. Probably it was about 3 weeks, I'd say, before from start to finish, where she was much more skilled and adept at fielding various types of scenarios.
Got it. Okay. So within about a month, Wemmerly was answering phones, scheduling appointments, confirming appointments, verifying insurance. She was doing all the stuff. She was just in there, sleeves rolled up, handling it for you.
Yeah.
Yeah. That's pretty amazing, because I don't even know if you could get someone up to speed that quickly if they were in person. And part of your staff. I bet that playbook helped. But what I really love is that virtual assistance component was so tightly integrated with Spruce, as you guys were telling me that then, you know, Wemmerly is in there documenting everything in Spruce, so that ultimately at the end of each day, you can go in there and look at everything that's transpired, and you don't miss a beat. So you have that bird's eye view of all the transactions, and you don't feel like, oh shoot, because I was with patients all day, I missed out on new stuff that was coming in. You actually had it all handled.
Yes.
Yes.
Yeah. That's pretty amazing. I actually have a question for Jessica, because I know when we introduced Jess, she had said that she's noticed an uptick sort of industry-wide with virtual assistants. Jess, would you say that what we're kind of talking about here is likely the reason why so many practices are picking up virtual assistants right now? Because pandemic taking a toll on retaining or even hiring new staff, and then B, having that extra layer where they're handling the admin, but the docs still have that holistic view of everything that's transpiring throughout the day.
Yeah, I mean, I think it's definitely multifaceted, but I think what Mark and Chris were touching on, and like staffing generally is hard right now, and it's so impactful if any of it goes wrong. We also have a lot of new practices that are starting Spruce, and so that's what I see a lot. And when you're new, you're really trying to be as lean and efficient as possible. So I think that's another reason we're seeing a lot more, because I believe you guys have a full-time staff person, but some people only need a couple hours a week. And so that's another benefit, because it's harder to find someone in person that is only going to come in a couple hours, so that's the other thing I think I've been seeing more, is the part-time as well as a full-time virtual assistants. And yeah, I mean, it's just, you just need someone to help, obviously. And it's just easier if you can expand it, not to geographic location. I mean, it's just logic. And so that's what we're seeing a big uptick in across all specialties, which has been really interesting. Because I think certain scribes have been very popular as a virtual kind of staffing person for years. I've seen that in person as well as at Spruce. But this is a new kind of trend that we're seeing, but we've been seeing this with other businesses. It's just new to healthcare. So I did get a good question. I thought maybe we could just go to it right now about kind of, so, and this could be for Mike or, you guys at Impact. So specifically, we talk about HIPAA compliance, which, is a very complex, multifaceted as well, thing. But, how Mike or Mark, Chris, are the VAs, are they HIPAA trained? What sort of security do you have for the computers? And, I can speak to Spruce, when you have a login to Spruce, it is secure. And so you don't have to worry about the computer as it's because of where it is in Spruce. But Mike, what are you guys doing as a business? Or Mark and Chris, what have you guys also done? So that was one question we had.
So I can field that first. After this, we can have a conversation with my security officer to get more in depth. But I think some of the main things that we do to maintain HIPAA compliance is basic things you guys don't think about. First of all, when people come to the office, they check their phone in their locker. There's no phones on the floor. You talk about the screens in the front of them. We have that as well. We also have smoked glass between each portion of the area, because not the entire area is HIPAA compliant. There's certain parts that are where we manage that there.
Cool.
So a couple of those are the biggest parts that people seem to forget. They're huge. The other thing is, from the more technical standpoint, we use Active Directory for passwords. We use something called Nagios for monitoring. But also the biggest thing is, not only do we have security officers on staff, but we use a third-party audit company that manages our entire process, called Digital Compliance. So that's the only way I feel comfortable as an owner that we actually have all of our ducks in a row, because not only do we have people internally, but we have outside company that audit our practice. So we know that we're all on the right playing foot. And I think that's the biggest part, is the audit for me. And that makes me more comfortable be able to competently offer the services to our clients.
That's awesome. So Mike, you guys didn't necessarily start out with healthcare in mind. At what point did you pivot and realize that there was a viable opportunity there? And did you take on sort of this HIPAA compliancy layer?
It was really based on, just like you said, we've been doing outsourced staffing for a while. Some people call it supplemental staffing. It was just based on a need. Someone came to us and said, is this something that we could do? A big part of outsourcing in general is listening. That's the biggest thing. And being accountable to the production of your staff.
Right.
And we've always been doing that in the customer service market, appointment setting, all that sort of stuff. And it was presented as a need. we followed the process, and it was good business for us. And
Yeah.
that's how we got into this. But at the end of the day, it's all listening and process management.
Got it. And just one other question too, because something Jess said made me think of it. It's not like someone needs to have a full-time VA with you guys. I mean, they can shape their own hours and choose days, times. That's completely subjective, right?
So our call center is offered 24/7,
Okay.
but we do offer a half-time option.
Okay.
So you could have a full-time staff or a half-time staff.
Got it.
Other than that, those are the two options that we offer
Okay.
currently to just manage the whole compliance correctly.
Yeah. Yeah.
I would, as a business owner, I would love to offer 2 hours here, 2 hours there.
Yeah,
But
that'd
the
be,
way that we were looking at it, this is the best way for us to be able to manage our compliance correctly.
yeah, but that follow the sun support is pretty incredible.
Oh, sure.
That's
Yeah.
awesome. I love that.
I have
oh.
some follow-ups on the HIPAA compliance and stuff,
Yeah.
if that's okay.
Yeah.
And just someone had a clarification. So Mike's with BBC Global, a staffing
Mhm.
agency with virtual, and he's talking about their own businesses guidelines around HIPAA. Spruce Health, we're SOC 2 certified and high trust. SOC 2 audited and high trust certified, as well as we have our own HIPAA compliance officer and do our own HIPAA compliance, stuff. And I'm happy to share our documents on that, but we each have our own separate policies there for HIPAA compliance, because someone had that question. Do you guys, Mike, do you guys sign the BAA with Impact, or how's the BAA work, if you know?
100%.
Yeah, so
We've done BAA. Yep.
Okay, great. So as a business, you signed the BAA with the second business. It's not the virtual
Mhm.
assistant, correct?
Correct.
All right. And then you mentioned call center. So someone was just clarifying the virtual assistants are in a call center. They're not working from
Yes.
home. So that was another one. And
Because that's the only way that we can manage the
Mhm.
HIPAA compliance part of it. If we had people in their houses, yes, you can. There's a certain way to do it, but the best way to do it is within our kind of area, so we
Yeah.
know what's going on at all times.
perfect. Yeah. And you did emphasize you do 24/7 support. So after hours. So great
Mhm.
option for those practices that do want to offer that in an efficient way. The other thing is, do the computers they use VDIs, or I don't know that term, but or is it
That's a great
VPNs?
question.
Yeah.
It's a great question. I wish I had the answer.
Okay,
I
but
don't have the answer personally, but I will find out that.
Yeah, so it's virtual desktop infrastructure, which I'm not sure why you might need that unless, you were trying to run certain apps on certain OSs. But maybe whoever wrote in can.
Yeah, we can get back to them and we can
Yeah.
have like a one-on-one there.
Yeah.
And like I said, after this call, we
sure.
can dive deep with anybody that wants to.
Yeah, I
Yeah.
love that. I love that. And I love these questions that are coming in. Let's get to some of these exciting outcomes and then we
Okay,
can
great.
keep answering questions.
And I'll get back to those ones that are still standing, guys. So keep them coming and then we'll get back to them.
Perfect. Love, and we can pepper them in. I just thought it would be exciting for.
Yeah, let's get,
Yeah, to just kind of, again, take a look at what these folks were able to do in such a short amount of time. So clearly, eliminate the admin from Mark and Chris's plate altogether, spend that time with the patients, which is what they started this practice to do. I mean, it was all about really giving that incredible quality care there. But I just find it fascinating that you guys were able to scale not only during COVID, but during winter. I mean, it's cold out. I don't know if people are exercising as much, but you're still getting folks coming in and your goal, you exceeded your goal of 3 to 4 new folks to 10 in 1 week in January. So, a couple more questions that come up for me. Would you say, I guess, kind of circling back to once you had Spruce and once you had virtual assistants in place, and I know Wemmerly was up to speed in about a month, in that time, were you able to completely extricate yourselves from that? Were you now operating with a free mind, no admin, just down to business helping patients?
That was it. We would hear the phone ring and we knew that she was going to pick up.
I love that.
Great feeling.
Yeah. Well, that's fantastic. And then tell me too, I mean, I'm guessing now that you had that behind you and you were able to do what you love doing, which is helping people, how were you able to scale your practice so quickly?
I mean, again, like, so because of the fact that we were no longer doing these administrative tasks, so we had plenty of room on our schedule for new patients. It was just that we didn't necessarily initially have the time to fill it up because of the fact that we needed to make time to do the administrative tasks. But again, since somebody was now doing that for us, fielding phone calls from patients, having to make outgoing phone calls to insurance companies, call back patients to go over their insurance benefits after the inquiries were done,
Yeah.
scheduling them and then inputting them into our EMR. It was a lot of stuff that we no longer had to do. And that's essentially how we were able to start filling up our schedule, because all we were doing is the PT component of that.
Yeah.
Yeah.
Yeah, and that extra time we were able to do like target or sort of do more marketing and and work on those things, like working on the website, working on this and that.
I was
things
going to
that-
ask if you guys were doing a little bit of marketing and beefing up the website. And then two, how did people know to download Spruce? When they would come in to see you on their first visit, would you say, hey, this is the best way to get in touch with us?
Yeah, so that's a little bit of a sale. You have to like really kind of get them in, because it's really easy when they do download Spruce. So you have to like in like a 30-second sales pitch, you have to like get them to understand the importance of it. And people that do get it, they love it. I mean, we have patients that they're constantly texting. And this is another thing, that if you're the type of clinic where you really want to drive patient care and really show patients that you're there for them, this is great. I mean, we have people on Sundays like texting us, we text them back.
Wow.
Yeah, so it's and they really take to that, because they know that you're answering their questions, you care, and you're trying to do right by them, which that's the whole mission. That's the reason why we got into it.
Carrie, one other thing I'd like to just add, you had asked, when does that conversation occur? It actually occurs on their initial phone call. So if they call up, a new patient calls up and normally takes the phone call, one of the things that she's trained to do is to ask the patient if they have a smartphone and if they're comfortable downloading a HIPAA compliant communication app, Spruce. And if they do, it makes her life a little bit easier, because again, she can send, once they download the app, Spruce, she sends them a saved message that says, welcome, this is Wemmerly, yada, yada, yada. Can you please send us this, this, and this? You can do so by following these instructions. And then they'll literally send pictures of their driver's license, their insurance cards, their doctor's prescription. And so then she's literally able to save that, upload it directly into the EMR, which is helping us to remain almost 100% paperless, which is great.
Amazing.
And then she can communicate back to them on Spruce once she has verified their benefits, what any out-of-pocket costs will be. And she can do scheduling, they can communicate, because it's a chat, so it's very easy to communicate. And
it's not really lost if they're not like tech savvy and they can't download it, because what you can do in the Spruce app is you can create a profile, and whether it's their home phone or their flip phone that it's not a smartphone, and that could be like the thread that you use to track the patient care from initiation to discharge. So yeah, it would allow us to communicate with one another, with Wemmerly, and to track. Right. You wouldn't be communicating with the patient through Spruce at that point, but it still allows us to have like a track record of when their, say, benefits were verified. If we ever needed to go back and kind of check that, it's very, very easy to search for things that were done in the past. Right.
And then everything is time and date stamped. That's
right. And then when they come into let's say, for instance, you have someone that's not tech savvy, they come into the clinic for the first time, they bring their insurance card, pictures, we just like from one of our devices, any Android device or iOS device, we could then just scan the documents right into Spruce. So, and then the integration between Spruce, which is really fantastic. I'm an Android person and I get a lot of heat for that. But the integration between Spruce and the Google Drive is pretty phenomenal. So like the ability to download directly.
I love that.
Question, kind of, since you're on that topic,
Yeah.
do you guys have an EHR? And does your VA have access to the EHR, and they're in there as well?
Yeah, that was one of the reasons why it took a few weeks to kind of get her up and running, because there's a million different types of, not millions, there's dozens of EMRs. We do have an EMR, and she has her own login and account for the EMR, which allows her, again, to create new patient accounts, schedule. She has our schedule up in front of her the entire time that she's working. So yeah, some of the handbook that I went over, that I mentioned briefly earlier, a lot of it was how to navigate through the EMR as well. Yeah.
That's fantastic. And another kind of technical question on like how you're connected, phone calls and stuff. Because they're out of the country and Spruce does require a 10-digit number, to sign up. How are you guys handling phone calls? Because I believe your virtual assistant is making and receiving calls on behalf of you from your actual US-based Spruce number. Can you talk a little bit about the setup and how that works?
You want to-
Yeah. So the phone calls, she has a like a Google number.
Yep.
And so it's being diverted to her Google number. And then in terms of making phone calls out, I believe she makes the phone calls directly from her Google number, not through the Spruce, through the Spruce 877 number that we have. So is that's kind of how it works.
Yeah.
I could probably speak more to
Yeah,
that.
someone was just asking, it can be challenging, and yeah, so you do have to use the Google Voice, because they can sign up for those and have it route and forward. And then in Spruce, when you open up the Spruce web-based app, they can dial this number from the Google Voice and it will show the main business Spruce number. But also a little update, we're working on updating this so that your VAs can just directly call from the computer as like a web-based calling. So that's one update that we're really, and honestly, one of the drives of that update is because of this huge increase in virtual assistants using Spruce to collaborate. So hopefully that helped answer your question about the Google Voice. And and also Spruce does have another option that we've done a couple times, where we actually ship our physical desk phones to the Philippines or to wherever the virtual assistant is located, and they can just use the phone to pick up and make and receive calls. So that's another option just for everybody logistically. All right. I have a lot more questions, but I'll let you kind of wrap this up, Kara, then I'll go to some of the questions that are coming up.
I love it. Well, I can't resist one more flywheel, because we have to have an after. We saw the before. This slide is pretty telling, because it really just shows you at a glance that after Mark and Chris implemented Spruce and BBC, as we've now probably said a couple times, the phones were answered, the appointments were scheduled, insurance is verified, follow-ups with patients are covered. It completely took that off their plate. And then of course, Wemmerly is using Spruce to manage and document all the intake paperwork, note any necessary consultations with third parties. And basically she ensures that the two of you are up to speed on each patient prior to a visit. But really, I mean, the best outcome here is that you now both are really able to take all the time you need with your patients to create those rehab plans, document your communication and collaborate and respond to patients quickly. And it's all inside Spruce, which is pretty incredible. And that's just kind of a fun summary slide, because with that, we do have some time to answer more questions. And
can I bring up one quick thing?
Yeah, of course.
So the one thing I want everybody to know is that this isn't magic, like from the virtual assistant standpoint. It's really not. It's, if you notice, Mark and Chris were very active in the beginning.
Mm-hmm.
So because they were very active, we got good feedback.
Mm-hmm.
So that's why it all worked well together. It's just, like you said before, it's the same as if you brought someone into your office to work with you to learn the process. It's the same exact thing.
Yeah.
So you guys got to think about that. If you're going to be available, it's going to go quickly. If you're not going to be available, it's going to go slowly.
Right.
If you're not going to be able to pay attention, it's not going to work well. It's the same type of thing. And that's why even when we begin an engagement, we make sure that the client that we work with is ready to outsource their process, because that's the biggest thing with all of this. I mean, with us, you have the same people, you have the same staff, everybody is the same. So we keep that control group in the beginning, we keep the control group in the same. But if you're not gonna have the time, I don't care who you work with as virtual staffing, it's just not gonna work out for you. So that's the biggest thing on my end.
That's a great point. And that's the golden rule, to your point, whether it's virtual or in person. Take the time on board, responsibly, and then you'll be set up for success. And it sounds like virtual assistance really was the way to go in this case for so many reasons. And I just, the whole story has come together so nicely. Jess, should we dig into a couple more questions?
Yeah, just a couple fact-based questions. Mike, can you clarify again what country your staffing are at and the English proficiency? And also someone mentioned that the Philippines has some climatal changes sometimes that require the office to be shut down. How do you handle things like that?
Well, we have two offices in the Philippines. We have an office in Cebu City and an office in Davao. Our HIPAA compliant office is in Davao. It's a city. It has the least issues when it comes to that sort of thing.
Okay.
So that's it. And then other offices was, I told you, the India, we have an office in. We don't currently do it there, but that's where our office is there. But with any third world country, you do have issues. We chose Davao just because it was a main metropolitan city, but things do happen. But to combat that, in our call center, we have a generator, we have backup internet, we do everything we can to mitigate any issues that occur. And I can get real numbers, but I think we had very little bit of downtime over the year.
Thank you. And someone had questions about pricing and different options. Can I have multiple staff and VAs? I would definitely recommend reaching out to Mike and talking your specific needs. From what I've seen, they're very customizable to what you need and can talk to you through that. So I think that would probably be the best recommendation, unless there's something else you need to add there, Mike.
No, that's it.
Okay.
I mean, our pricing is very simple. Just kind of like if you hire someone internally, it's $10 an hour per person. If there's no terms, if you hired me to work for you at $10 an hour, if I do the work correctly, you continue to pay me. If not, you fire me. It's very simple. We try to take all of that confusion out of the process.
So another kind of fun questions that I'm seeing come in. We have some Spruce customers obviously on the call, and they really wanted some advice on how are you, and this is more Mark and Chris, a phone call comes in, a voicemail comes in, a text message comes in. Is Wemmerly, are they the first line? Do they archive the message? Do they always send it to you? Do they do an internal note first? Any advice for other Spruce users out there that are using, an assistant?
Yeah, so we actually have set up a phone tree. So the first thing that happens when somebody calls our number is they have a menu of options to choose from. So there are some situations where we might want a call to be forwarded directly to the office and bypass Wemmerly, and that's really it's for people who have questions about the services we offer that she may not be able to maybe field multiple questions that are very specific to, say, PT. She's not a clinician, obviously. So and then there are several other options that if those options are selected in the phone tree, if it's a new patient looking to schedule an evaluation, or if it's an existing patient, calling just for scheduling needs, those phone calls will get forwarded directly to her. Does that answer the question? Is there more to the question?
Yeah, I mean, if you're waiting for a doctor's, we have a doctor's, selection. So doctor's offices will call directly to the office. So if you're waiting for, clarification on like weight bearing status or something like that, look at that info right here in the office.
What about internal notes? Do you guys use internal notes?
Constantly.
Yeah.
So yeah, whenever phone
Like
call
more
comes
specifically,
in,
how? Like people want your advice because you've been using.
Sure. So yeah, so any phone call that comes in, for people who are already familiar with Spruce, you probably see that it's listed very chronologically. So, let's say it was, some telemarketer, Wemmerly will say this was a robocall or something, and then I'll quickly block that forever. But yeah, so any phone call that comes in, she'll make a note. This patient, Bob Smith calls in, patient calls in change his appointment from 10 to 4, something like that.
Right.
So she's literally documenting internally every single phone call that comes in and what the phone call was for, and basically what she did to manage it.
Right. And then like, let's say for instance, faxes come in, let's say some, doctor fax a script over for a patient. You could take that fax and you can either copy the fax and bring it right to the patient's thread and then dump it in the patient's thread, or you can create a link. So let's say for instance, you sent out like a plan of care, you faxed out a plan of care and it needed to be signed. You could document, you could fax out through Spruce and then copy the link to that fax verification and then bring that into the patient's thread. So there's a lot of different things. And what we also found was that you're able to like even, you're even able to connect your EMR. So we use WebPT. Let's say for instance, I want to direct her right to a page in WebPT. You can just copy the link from WebPT and put it right into the thread and it will direct her. So she doesn't have to thumb through, it'll take her right there. It makes it much more efficient.
Yeah.
Any additional tips for people getting started with their VA in Spruce, whether, do you use assignment, archiving? Like, do you assign things to each other when it's, if a voicemail comes in, or do you just use the internal note features?
Yeah, I imagine as we get bigger, we probably will do that. Right now, it's just, whoever gets the message first deals with it. So, it's just Chris, myself, and Emily. So,
Yeah, I've seen that approach before. It's kind of like, and we actually do that in our own support of Spruce. It's an inbox, everything comes in, and whoever's available just goes from oldest to newest. And so it sounds like your guys are doing that, but maybe when, Spruce has the ability to do teams. I see some people will have teams for different, billing issues or new patients. So I'm happy to discuss that once you guys do have that growth. And those that had questions, feel free to ask specific questions as well in the chat.
Yeah, and so Jess, one of the just popped into my head. And so we can also have our biller with Spruce access as well. And so she would be able to, again, look at eligibility and benefits information that Emily has gathered and put in the threads. And then she can make comments to us, regarding whatever authorizations and such like that. So it integrates nicely from that aspect as well on the back end.
Yeah, like our biller wants us to avoid entering in insurances. We screwed that up a couple of times. So it's really nice to have like the front desk, directly communicate to the back desk, especially if there's a new insurance that needs to be loaded up.
Nice.
All right. There's lots of questions. I know we only have a certain amount of time. I see all the questions. And so I'll try and respond to you individually, but also if you're a Spruce customer, feel free to message into Team Spruce. I saw some specific questions about, I have this many therapists or this many staff and this many VAs, what's the pricing? I'm happy to talk you through different pricing and what that would look like for your specific setup. Feel free to email me or you can also message into Team Spruce. But yeah, Kara, I mean, I have probably like 7 more questions, but I know we're coming up to the hour.
Well, we can probably take 1 or 2 more and then I'll just take us home.
Okay, great. I just want to clarify, this question's come in a few times, but Mark and Chris have one VA. It's like having their own employee. I mean, it doesn't switch every day. It's not a call center in that it goes to a different person each day. That's an option that BBC has for that use case. But in this instance, it's like hiring your own staff. And so they know it, they learned it, they're now up and running. Somebody also said, do they have experience in Spruce? They do, they have experience, they've learned it. Spruce is pretty quick to learn as well. So it's more the processes for the specific business that we find take a little longer because every practice, is so unique to kind of what insurances you take, what the process is, all of that. Okay, let me see what other questions. Okay. And someone asked about my contact info. It's sales@sprucehealth.com. That will go right to me. So you can do that. Oh, legal question. I thought this was really interesting. And if I don't know if you know this specific, if we keep outsourcing the staff to other countries, will the unemployment go up? DOL be happy? I was just thinking out loud. So like, have you guys just, is there any legal stuff that you have to think about when doing outsourcing? You know, how's that work?
Is that a Mike question or a,
I don't think it's a me question.
I don't know who that's
Oh,
for.
I'm sorry. So can you? So
Yeah, it's a good question. I suppose I don't know like the specifics about you know, whether or not we're not allowed to outsource. I don't know if I quite understand the question, perhaps.
I know, was it more of like a, oh, are we not? I'm not sure if it was
I don't
like,
know.
oh, we're hiring outside of the US, or I didn't totally catch that one.
Well,
either.
there's two questions and I
like-
can't find the other one.
Yeah, I
Um,
mean, in terms of the reason why we
Oh.
started looking for outsourced was because domestically it was much more like we weren't able to, you know, we weren't able to get people to even interview, or it was difficult to even get staff in here, whether, you know, we, you know, like in the future, looking to hire domestically or locally, you know, that, you know, as we grow, we'll be considering that.
I mean, and we're pretty small at the moment, and so like
Right.
if somebody came in looking for, you know, full-time hours with benefits, like we can't offer that at this point in time. So, you know, this is a pretty good way for us to mitigate that as well.
And from a BBC, I didn't read the question. From a BBC standpoint, we do employ American staff members as well for some of our campaigns.
Right. I mean, like most of like initially in our interface, like when we were interfacing with BBC, there's this domestic team that, you know, is, you know, that brought it, that helped facilitate the onboarding process, which was really, really helpful, just kind of like guide us through and then orchestrated until like everything just started to run smoothly. And then even so, there's lots of check-ins as well. There's you know, scheduled, you know, monthly meetings and so forth. So and they help develop the scope of work, if you will, is what I believe that it's called, which is that big manual, you know, of how things roll. And so in the event that needs to be a change in terms of or switch of the virtual assistant, they just roll out and then make the change.
Nice. Thank you for that. So many good questions. And Jess, thank you for running through those. What we can also do too is review those questions after. And if there are some specific questions that we can answer, we will respond to you directly. And you can also reach out to the appropriate folks as well. So just to take us home here, we've got a quote that Chris left for us, which I think is really powerful. And that basically by combining these two solutions, Mark and Chris were able to achieve their vision for providing high quality unrushed care while growing their practice. So I love that. And I really, really want to thank Chris and Mark for joining us today, Mike from BBC, Jess from Spruce. This has been eye-opening for me, and I'm hoping the same for everybody else who's joined us. You'll see that we've dropped in some great resources here. I'm going to follow up with a link to this slideware so that you can get to those links. And before we close, I just wanted to let you know that we're having another fun webinar next month, June 13th. We're welcoming a partner of ours, Patrick Casal. He's a licensed mental health and addiction therapist, group practice owner, and private practice coach and strategist. And he's going to help us better understand how to start or grow your practice with the right tools, manage workload, burnout, and even work more flexible hours, taking more vacations, which I think we would all love. So whether you're a therapist or you're in another group practice, I think there's going to be some high yield information for everyone here that attends, and I'll send that registration link in the follow-up email. With that, I'm going to close this out. It's exactly 12 noon. Thank you, everybody. So glad you joined us, and thank you, panel. You guys were terrific. Really appreciate it.
Thanks, everyone.
Thank you very much.
Yeah, thank